Morning. Can everybody hear me?
Good morning. Yes, ma'am.
I'm sorry, I just got in. Are we ready to start or did we need to give it a little time?
It is not quite 11 o'clock, and
Okay.
I apologize. This is Erin for the Department of Medicaid for the record. So it's not quite 11 o'clock. We'll give a few minutes to let everybody filter in. I do want to apologize for the link issue. It worked last month. We had some TAC meetings that disappeared in Zoom, and I thought Kelly and I had them all worked out. And I usually test them first thing at 8 a.m. in the morning, and I got sidetracked with some other things this morning. And so I apologize for that late notice that we had a new link.
It happens, but it all works out.
Well, I'm glad I didn't log in right at 11 and figure it out. And I will get a new link for the rest of the remainder of the calendar. I just wanted to get one out for today quickly. So,
Okay, thanks.
you're welcome. And it is, excuse me, 11 o'clock. The waiting room is clear, and I counted 3 out of 5 members, unless Marlene or Susan snuck in on me. Okay, so I'll turn it over to you. And again, I apologize for all the chaos this morning.
No problem. Evan, did you know if Susan or Marlene had they contacted you?
I haven't heard from Arlene. I think Susan might have had a conflict for today, so we probably won't be seeing her.
Okay, so if the 3 of us, that's still a quorum, right?
Yep, 3 of 5.
All right, we'll get started. Wanted to thank everybody for being here. To start with introductions, I'm Anlin Purden with the Hazelwood Home Health.
I'm Evan Reinhardt with the Kentucky Home Care Association.
So this Perez, Green River District Health Department.
Okay, is there a motion to approve the minutes of the April 9th meeting?
So move.
Second.
Can we have all voting members on camera really quick, please?
Cadis, are you able to get your camera?
Yeah, let me see if I can do that. 1 second.
Okay. All right.
That should be on now.
Yep, thanks. All right, and I agree with it, so the minutes are approved. And I apologize, this is my first day back from vacation and I am so discombobulated. I just barely got the top of my desk cleaned off to put my laptop down to do this meeting. So Evan, if you don't care, will you, because I haven't
sure.
looked over this morning.
Just jumping in, I think there's an EBV update on the time for the hard edits to go into place. So I don't know if anybody from DMS is able to speak to that.
It looks like Pam is joining as we speak.
Okay.
And all of our members, I do believe, are on now for the record.
All right.
Thank you.
We'll give Pam just a minute to join here.
I'm here. I'm sorry. I was having having trouble getting in. My computer's been giving me trouble all day. So
No worries. So we're just looking for an EBB update, Pam. I don't know if you or one of your team can touch on the latest on the hard edits going into place and all that kind of stuff.
we will not. We made the decision not to turn the hard edit on until PCS is transitioned. So we're going to continue doing the monitoring that we're doing. We're working on the report cards that are going to formally go out to providers. We've been reaching out to individual providers. If we've noticed, anything we needed to discuss with them. But I will say honestly, we've been very, very pleased with the adoption and the use of EVV in home health. It has went very well. So like I said, we have addressed specifically with certain providers, if that we noticed that there was technical assistance needed, and we're working on a formal report card process that will continue even after we put on the hard edit, right? We'll still look at things and still have those conversations, but we will not be turning on that hard edit until until PCS is transitioned over.
And you don't know I mean, any guesstimate on how long that would be, Pam?
All of this year.
Oh, the full year, okay. So at least until 1/1 of
No,
next year.
fall, FALL.
Fall, sorry.
Fall. Yeah,
Gotcha.
sorry. The fall of this year. So probably like October.
Perfect. Any questions from the group for Pam on EVV?
No, I do not.
I will say applause to everybody. It has went very well. We've been very, very pleased with the adoption percentages and what we've seen so far. It has looked very good. So congrats to you all.
Which we never used it
Can
in
you all hear me now?
TLS,
It
but
looks like,
their app's great. Or has been for us so far.
can you hear me now, Inland? Is that
Yeah.
better?
Yes.
Okay.
Good morning. This is Marlene. I logged off and came back on, and I can actually hear now. Thank you.
Yeah, it just dropped out for me, so apologies about that. So type of bill, I think we got a little bit of information, but I'm not sure if we got every MCE or MCO to respond to that specific inquiry. So Anlin, do you remember where we kind of finished up on that?
Actually, did any of them send anything in? I haven't received it.
Yes, I sent you guys an email with all 6 MCO's information. Pardon me 1 second, I'll let you know. I sent it on 5/29, and I can resend that to the group just to make sure. I know sometimes emails get very.
I do. Okay, let's see.
Yeah, I think it's in response. There's it's all chain of emails to that last TAC meeting question starting on the 21st.
I just resent it, so it should be towards the top of your email soon.
Okay.
I do see that when it says it has an attachment, but I don't have.
So we'll take a look at that and see if there's
Yeah.
any follow-up for as far as type of bill. Any other
Yeah.
specific issues that Anlin, I think you were having with TOB?
No, just once I get that and I can look over it, and then I see Medicaid. Actually, I think it was dated for March, their new manual. But I think it must have been posted later than that because I picked up a new one before that. But anyway, okay, I'll just look over the email and
Okay.
once I get that. Thank
And then
you.
same question we have for the updates on the supply fee schedule. I think some folks are kind of in limbo out there in terms of where things stand. So I don't know if there's an update from DMS on that.
So we're doing a review right now of the whole fee schedule, looking at the limits and potentially removing authorization based on certain limits, or kind of updating that, and also aligning where we can any costs, so that we so that's in alignment with with changes with DME. But as far as I'm aware there were only 2 things that had not been added, which was the new drain and those extra large briefs. But otherwise, the fee schedule, we're not, I do not believe I know we're not taking anything off of the fee schedule. I'm not aware of anything else that we're adding unless you all have sent me something, a request to add something else that I have missed. But we are in the process of doing a comprehensive review of that, as well as looking at the prior authorization requirements of supplies to try to make that less burdensome.
Yeah, those 2 additions were the only ones that we had on our side. So we were just waiting for, do you have any idea, any expectations for when that would be finished, Pam?
Hopefully soon. But I can go on if those 2 missing are preventing, services from being done for supplies. Can try to go ahead and get those added. And then, hopefully by the end of this month, we'll have the review of the fee schedule done.
That would be great. I mean, I think that was our issue, was just making sure those 2 things are on there, and then, everything else will be awesome to have as an addition, but, getting those 2 things, I think, is the short order.
Jackie. She says,
And they are in the system as covered, so they may not, so even though they're not showing up on the fee schedule, if they are provided, they are in the system as covered. It's just that the fee schedule itself has not been updated. Yet, the one that's online, so.
I have a question. This changes to you said the prior auth process. Does that mean for the MCOs as well?
I cannot speak for the MCO, so it would just be for fee for service.
Okay.
And I can say here recently, we've turned down 2 Medicaid with I still call them Plerex drains, but whatever that kind of drain is, because it's still not on the fee schedule.
So it is covered with that specific code. I know that Evan, and I don't have it right here in front of me, and I can find it, but I can send that to Aaron and have that come and have that go out. But it is the pricing I know that we had talked about, and the specific code. And then we will get that updated as soon as we can get that updated online.
Oh, so we can go ahead and request an auth for it?
Yes,
It's
yes,
just not
and
online.
it's just not online, right? The pricing and
Oh.
everything is in the system. It's just
Okay.
the fee schedule itself has not been updated.
Okay. So I'm assuming, are we still paid like we are, well, through traditional Medicaid for all
Yes,
other
it's the
supplies,
same,
our
yeah,
percentage?
yes,
Okay.
yeah.
Okay. I didn't realize that. So that's good to know.
Okay, so let me re-ask my question again. Does that mean that the MCOs will or will not cover Plerex drains, or again, is this just traditional?
So I am speaking for traditional. I believe they do follow our, and I'll let some of the MCOs, as far as the items that we cover, that they do cover at a minimum those items. So, but I will follow up with the MCO team and
What you hit my point, Pam, is they're supposed to follow what you all do. So supposed to is the operative word.
I haven't seen who, I don't know if somebody from our MCO team is on. I haven't seen that. I haven't looked through who is online right now. So, but I'll get with that team. And to be fair to the MCOs, this may have been a failure of communication, and that code may not have, when we added it, the coverage, it may not have gotten communicated to them. So, we'll make sure that happens. I'll talk to our our team in-house, and make sure that that gets communicated out to them the appropriate way, because that may not have happened.
Yeah, if we have it in writing from you all, that always helps too. So getting that through to Aaron, that'll be great. Anything else from the group on the supply schedule?
And this isn't old business, Evan, but I do have a question related to the waiver, and I don't know if that would be new business or where to ask my question.
Fire away, go ahead.
So, I did just a glance at the waiver fee schedule, and I saw that the biggest change from what I could take with the eye is case management increase. So I just want to verify there is no increase in reimbursement for attendant care, and for attendant care and some of the other predominant services. Am I correct in that?
It depended on if the rate was, so the rates were funded at 70% of what the rate study determined. So if the rate was already with the 20% increase that was given, or the 10 and 10 that was given in state fiscal year 23 and 24, if that rate was higher than what that 70% was, the rate stayed the same as what it is today. If it was lower than that, it was raised to the what the 70% of the rate study amount was. So there were some rates that changed. And also for the providers that had already signed an attestation, or at the time that was available, signed the attestation to pass through 85% of the 50% increase, some of those rates, but that is provider specific. So that won't be you won't see that on the fee schedule, but there were all of them, depending on where the rate was today compared to 70% of the benchmark is where the rate amounts were. And I don't have that up in front of me right now to tell you exactly which ones changed, but there were some other services that did change in addition to case management. But HCB case management in particular had a significant bump.
Yeah, I picked up on that one. And then we also got a letter from asking for our policies and procedures relative to the waiver program.
Yes.
How do we know we sent them up? What's the process now?
That should have, so the letter didn't outline exactly what. So what we're doing, let me just back up. I'll start
Okay.
back. Is that in addition, we are making all of the waiver providers be certified waiver providers. So while some still you may have to have a license, or in the case of some of the adult day, a CON. Like if you're a home health agency, you have to have a license. But in addition to that, we are making all of the waiver providers be consistent. So all of the waiver providers will go through a certification process. So part of that includes review of policies and procedures. And then it's essentially, we'll do everybody one time. And then at each quality review, that's part of what we review. I can have, and I think I may have saw Gina from Dale on, but if there's questions about the process or what you need to send, if you reach out to Dale, they can help you through that, because they'll be, as the operating agency of HCB, they'll be the ones that are reviewing that. And I thought I saw her, but now I do not see her. So,
Well, we submitted everything, Pam. I just don't know.
Okay.
I mean, what happens next?
So
you have it.
So they will review that, and then you'll get a letter that basically says either, you're certified, or if there's questions, or, there's things that don't match, the waiver, then you'll get communication back. So you'll either get communication that we need more information, or we need changes, or you'll get a letter that says you're certified. And that'll just align with your regular, your dates that you see in Partner Portal and all of that. It'll be up to 2 years.
Okay. And how long should we expect to receive some type of communication?
It's about 45 days.
Okay. We've not exhausted that yet. I just wanted to be sure we don't miss something.
If you have any questions, feel free to reach out to me. Okay.
Okay. Well, what was your name? I'm working on one monitor today instead of two.
That was Gina Oni with Dale.
Okay. All right, thank you.
We hope once we realize it'll be new for, in particular, our home health agencies. But we hope that then once we get through this process the first time, then it'll be normal, and it'll be, part of just the normal reviews, that we have. But it's an effort for everybody kind of to be, everybody will be consistent, and how we approach everything, and we think will lead to higher quality. And hopefully less questions amongst the providers.
And Pam, real quickly, the biggest thing that I'm seeing is when I review the employee files, there is no central registry check for child abuse and neglect, but it appears that the home health agencies only had to do a caregiver misconduct. So I'm working with several home health agencies right now to get those central registry child abuse and neglect checks done through caregivers. So that's just one of the things that I'm seeing kind of consistently across the board. And when I researched it, it looked like it was because of the home health licensure reg. It doesn't require that. It requires the caregiver misconduct. But for the waiver, you have to have that CAN. So that's just it's a registry check, child abuse and neglect, we call it a CAN. So that's just one of the things I'm seeing. The policy and procedures overall look pretty good. They're just a few specific things that to the waiver that we've asked for a little bit more information or worked with the agencies to try to fine tune it to make it more waiver specific on. But if you have any questions, please reach out. Okay.
Okay, thank you.
Gina, I'll send you an email if you have a list of whatever those common issues are. We'd love to be able to send that out to our membership.
Just send me an email. That'd be great. And I'll follow up. Okay.
Will do. Thank you.
Evan, could we put on our next agenda just to update, waiver is not something we do a lot of. We just do case management and very little at that. But I'd love to know, kind of since we've been out of the waiver program, how the program's doing. Is it, is there still a wait list? Where are we? Is there still a black hole in waiver?
Well, there's still a wait list, and I think there's some efforts underway to reevaluate how that list is managed currently. So, I think it's maybe the timing's right for us to have a discussion on that.
Okay, thank you.
Just, which we don't do waivers, so I don't have a dog in this fight. But I did notice that Susan did that the attendant care and the personal care didn't raise, and there's this push to pay aides more. So I find it odd that the rate study didn't show that, or it showed just what people pay aides now and not an increase.
Well, it was an
needed.
increase. I mean, it was an increase, but I will say the rate study was based on feedback from agencies on what they are paying and what they are, and what they, their actual cost, as well as it was based on, in some cases where like the national standards like Bureau of Labor Statistics or some of those were higher, we always took into consideration the higher amount. When we looked at the rate study. So we didn't want to undercut that, any agencies that potentially were paying less because of just the environment right now. We would give the benefit of using the higher of the two, whichever it was, whether it was like Bureau of Labor Statistics, that information, or it was what the survey showed from the agencies.
Thanks, Pam. I always appreciate your willingness to help us.
I'm trying. I wish we could find workers. I don't know where all the workers have went. And I think that's for almost every single industry that's hiring people. But yet I heard something yesterday where there was somebody that's daughter was applying everywhere for work, and was having trouble even getting an interview. So I will admit the whole situation kind of perplexes me. We can't find people to hire, but yet when you have people that are willing to work and want to be hired, they can't seem to get interviews. So I think it's a very perplexing problem, just overall, just not even just the healthcare industry, just overall in general. I think it's an interesting dilemma. So,
Well, I mean, from our seat, I mean, you can't find aides, you can't find nurses, you can't find PTs, you can't find a whole lot of anything, so.
it's really, and I can understand that from, from interviewing even the positions that we have, but I thought that was interesting when I heard from, that here you have somebody, and hers wasn't necessarily in healthcare, but it's kind of an industry-wide thing you have where people are trying, they're saying they can't find workers, and then you hear people trying to get interviews and they can't get interviews. I think it's a very perplexing problem. So
They can make more money staying home.
Why can't I figure that out?
We started working, Anlin, so we got to keep on going.
Or we need to travel, right, to make the big bucks outside of Kentucky.
All right, anything else for new business?
If back on old business, we could jump back to the type of bill. So now that I've looked at the email, which passport, I don't do that one. So all the rest of them, I understand Humana's and Aetna's and United's, but Anthem, they've just put that they do 32X and 34X. So the problem is what the X is. Is it a 1 or because the old Medicaid prior to the new billing manual, everything was a 3-2-1. And that's what some of them used to go with. And like, that's actually what we bill Anthem with now. But I don't know if I need to update the 3-2-3 if it's a continued bill, 3-2-4 if it's a discharge claim. So if they could expand on theirs, I think I got everybody else's.
Is anyone from Anthem on that could speak to that? If not, I can follow up with them.
This
Hey.
is Holly with
Oh, hey, Holly. I'll let Holly explain.
Hi. Well, Holly doesn't know the answer. Holly was going to have to ask because I'm not sure what the X means, but I can find out. Jennifer, do you know?
It's typically a placeholder for another number, like for the 1 or 2 or 3 for consecutive billing. We would follow standard billing guidelines and per what the state requires. So,
well, like when I started with Anthem, I tried doing the 3-2-1, 3-2-2, 3, and I couldn't get anything paid. And I kept getting well, we can't tell you how to bill. And finally, one person emailed me and said, please just make them all 3-2-1, they'll go through. But now that Medicaid's updated, I don't know if we're updating, and I'm going to, because it will process with 3-2-1. But then on audit, somebody comes back 5 years from now and goes, well, that really should have been a 3-2-3 because it was a continued bill, or a 3-2-4 because it was a discharge. So
I got you.
And I can't find an actual billing manual that's because all it says is like the 3-2X.
I'm going to put my email address in the chat for everyone. If you want to shoot me an email with information, I'll follow up, and I will with the state as well. Or if you want to follow up with me from the state, I'll look into that, and Holly and I will work on getting you and everybody on the call an update.
Okay, thank you.
Billing.
That was all I had, Evan. Thanks.
All right, we did have a question in the chat, and I don't know, Gina, if you can answer this, to speak to the training and qualifications for waiver assessors.
So actually, we manage this, so I'll take that from Gina.
Okay.
Medicaid manages them, so I am not, since that was not on the agenda, not prepared really to fully address that. I mean, they are specifically trained, but we can, if you want to put that on the agenda, we can address it at the next meeting.
Okay. We will plan to do that. All right, anything else for new business? Not, we'll head to general discussion, updates from the MCOs, then DMS and or Commissioner Lee. So we'll start with the MCOs. Anthem, since you all are top of mind here, you all want to go ahead?
Yep, it's Holly again. I don't have any updates or any common billing issues to report.
All right, we'll let each of the MCOs chime in here.
Yeah, hi, this is Anna Page from Passport. I too do not have any issues or billing issues to update.
Hi, Evan. This is Stuart with WellCare. Same thing. We did the round table huddle, off billing, and nothing. Nobody had any issues that they're aware of. Nothing to report.
This is Herb with Humana. There was no real main issues as well. I mean, we saw some of the common denials, but there weren't necessarily issues. They were just things that we saw from some of the billing errors. The only other issue I noticed was the Q5001 being billed. And I was just wondering if providers were seeing any kind of a payment issue when they were billing with that code on their home health.
We haven't
We
been
don't
made aware
bill
of one
that
with the
on a
association.
Medicaid claim, so.
I'm sorry, what's that?
Like that is a Medicare code, so I've never billed that on a Medicaid claim.
So I'll say that at least Humana and 2 other MCOs have seen Q5001 being billed on Medicaid home health claims.
I wonder if it's just a system issue with that agency. Because yeah, that's just the place of service. That means that the service was done at the home.
Right.
for
So you're saying that
Medicare.
shouldn't be on the Medicaid claims then?
We've never billed it on a Medicaid claim. Like I said, there's usually, like for Medicare, there's only 1 cent attached to it, just as a placeholder. So, like I said, I don't know if that would cause an issue for it to go through. I don't know if anybody else that's on actually does billing. No, so all I can tell you is we don't bill it on our claims, so I've not had an issue with it.
Okay. All right. I'll tell you what we'll probably do if it's okay, we can follow up with some of those specific providers who are doing that and make sure that they were not perhaps unintentionally billing Medicaid thinking it was Medicare with that code.
Or they could be like me and sometimes set it up on the wrong payer. I do that every now and again.
I mean, if Medicaid is your biggest business, right? And then all of a sudden here comes Medicaid and just follow the same process. So.
Yeah.
But that's all. Thank you for that information.
Anybody from United?
Yeah, hi, this is Suzanne Lewis. I'm from United. And I was gathering my update for you. We've got, looks like about 3 providers who may be having trouble with the EVV validation. So it looks like some of them are showing up with their facility. One has some claims that are flagged for no match. One has 3, I think we had 3 claims kick out for no, flagged for no match. And I'm waiting for an email to drop in my inbox with more specifics, but basically we're working with them on those issues right now. So, and I apologize. I'm covering for someone that's out of the office on PTO. So I'm getting secondhand information on this as we speak, and I'm not the expert, so I apologize. But yeah, we are finding some issues with this. I'm looking at a note here real quick. Okay. So anyway, just we've found some of those issues. Anyway,
Any feedback we can send to our members, please pass it along. We're happy to, try to update the group and make sure everybody's up to speed on what they should be doing as far as processing those claims and making sure their validation's up to date.
Yeah, I think what again from my information that I'm getting, it looks like this was kind of came through DMS. So we've been working issues. It wasn't an internal issue here at UHC. We've been working through DMS. So I don't want to report anything that was just specific to us. It looks like
Sure.
we've been kind of working it out, as through the implementation. And so again, not specific just to us or an internal issue. Just wanted to make sure that I gave you guys a report.
UHC, you're not requiring it to actually pay the claims. Is that just an update on kind of what needs to be fixed, or is it required now for claims to pay?
That's a great question, and I'm probably not the right person to answer that. So
I don't do UHC, so I was just curious. I didn't know if you all were following that all the MCOs were following along with the state, or if there was a different date for each MCO.
I don't know the answer to that. I'm sorry. I can get one for you. Does anybody else? I thought like it was pushed, the EVV was pushed back, but
Yeah. Sorry, you're talking about the hard denials, EVV hard denials with MCOs?
Yes.
Yeah, that's been pushed.
okay, thank you. I didn't want to say the wrong thing, but I thought that had been pushed out. Yeah.
Okay. Thank you.
Yeah, we're just doing soft denials. I think it was scheduled to turn the end of June, but that's why when the state had mentioned in the very beginning, or KDMS had said, that's been pushed. That's applicable to the MCOs.
Yeah.
Okay.
Isn't that out till August now or something?
That's the target.
Target. Okay.
Yeah. But they
Yeah,
promised
well,
to give us 30 days advance notice before
right.
that. So.
Yeah, right. Okay.
Thank you.
One thing I did notice, we weren't necessarily looking at like the actual EVV data per se, but one things we did also see, and I think because we hold a weekly work group with all the MCOs together, and EVV is a common topic, and we did see something similar where like they would put in a certain revenue code in the therapy data in the therapy authorization, but they would bill a different revenue code, and it's usually very slight. Like they'll put like a 410 in the rev, but then they'll bill a 420 or a 430. And the state's been very specific. It's got to be an exact match.
Yeah, those are completely different services. So those would be
Yeah.
completely different therapy. So that is an important key, is that what the authorization is for matches with the visit.
Yeah. So I just want to make sure, that the home health realize that, even though it's the same member, same provider, same data service, it's really not the same service as what was authorized.
We'll make notes on all that. Appreciate that, and try to get some info out to providers just to make sure they're matching all that information up.
Yeah.
Anything else from the MCO side?
This is Etna. We don't have any updates or any major issues to report, but just wanted to let you know.
Thank you. All right. Any other updates from DMS? I think that, Pam, that's probably your area there.
I think we have covered the majority of things. We talked about, supplies we're looking at. We've talked about waiver, and if there's anything, I think you all were going to put that on the agenda for the next. There's of course a lot moving with waiver right now. The finalized rates from the rate study came out. They were working on updating the waiver applications themselves, so those will be coming out for public comment probably sometime in July, because it'll have to go to CMS. We were given slots in 4 of the waivers in the budget. So in July will be most applicable to you all. We'll have more slots for HCB that we will be allocating. And then an EVV, of course, and we talked about that, so.
All right. Any updates from Commissioner Lee? I assume that kind of summarizes everything, Pam.
Yes, she is in actually at a conference this week. So, but yes, that kind of summarizes in general everything all of the updates.
All right, very good. And I don't think we have any recommendations today. MAC meetings. Susan will be our rep there for the MAC meeting. And our next meeting should be August 13th, I think. 11 a.m. August 13th. Anything else from the group?
I don't have anything else.
We had another question in the chat about how many slots are opening and how many folks are currently on the waiting list. Pam, do you have any of that?
I don't have the numbers right here in front of me since it wasn't on the agenda. Let me slots. Let me see if I can get something really quick. I can get that faster than I can the wait list numbers. I don't have those right here in front of me, but the slots I do. I can give you, well, I thought I had something, let's see. So, we were, for, state fiscal year 25. So what begins on 7/1, 250 in Michelle P, 125 for SCL, 250 for HCB, and 25 for ABI long-term care. And that's for this upcoming fiscal year 25. There were more slots. I think actually the same number for fiscal year 26. So that'll be 7/1 of 25 that those would start. And we do already have approval from CMS on those slots. We've got that already done. So beginning July 1, we'll be able to start allocating those slots. We won't dump them all in at one time because then that just creates a different problem. Then you have people, instead of them being on the wait list, then they're waiting in line to get assessments and to get services started. So we will be doing those a little bit at a time, and we're working with the sister agencies and talking about that right now and how we're going to allocate those and what the best number is to do at a time.
Pam, at our next meeting, do you care to bring the total number of slots? I mean, I know we got 250 additional, but what's the total participation?
What the total count is? So you want to know the total number of funded slots we have, how many people are active, and what our wait list is. Is that what you want?
Yeah, that's what I'm interested in. Thank you.
We can do that. Yeah, we can do that. We can do that next time. Absolutely. I apologize, don't have those numbers in front of me right now to be able to do it.
Didn't expect you to.
All right. Unless there's anything else, I think we can go ahead and adjourn.
Thanks, everybody.
Thank you, everybody.
Thank you all.
Bye-bye.
Have a good one.
Thank you.